Assalamu alaikum guys, I am Dr. Faraz Ahmad, and today in this video I am going to tell you about OET speaking subtest. So as many people were asking about speaking videos, so I have compiled this video for you people out of my busy routine. So let me introduce you about speaking subtest. So everyone knows as there would be 2 role play cards in the speaking subtest, and you will be given 3 minutes for reading of the card, and then in the 5 minutes you will have to speak according to the task given in the card. So guys, keep in mind the exam setting. While you will be in the room, interlocutor would be there. So keep in mind that he is your patient, not your examiner. So you have to behave like doctor, and you have to behave with the interlocutor like a patient. So behave like a doctor and behave to the patient. Don't worry that he is your examiner. Okay, so this is important strategy for speaking. So before start of the conversation, before start of the recording for the audios in the speaking exam, you will be given some time for warm-up questions. So there is another important thing I want to clear here, that in warm-up session, in warm-up questions, audio will be recorded as a proof. It will not be marked. So keep in mind that it will be recorded as a proof that interlocutor has given you time for warming up. So they can ask you some questions regarding introduce yourself, why are you taking this OET exam, why you have choose medicine as your profession, what are your future plans, and they can ask any questions like this. They will be proved that they have given you time for warming up. Okay. So guys, now I would like to tell you about the speaking strategies and speaking guidelines. So there are 3 or 4 basic strategies which you have to keep in mind before the start of conversation. First of all, always speak in natural tone. Speak in natural tone. Don't try to copy anyone. As if you are Pakistani, you are Asian, your accent would be changed. If you are Arabian, your accent would be changed. If you are from African countries, your accent could be changed. So always try to speak in your natural accent and natural tone. Secondly, speak loudly. If you are going to speak loudly, your audio recording would be clear. If you are not going to speak in a loud voice, then your recording could be muffled and it can create problems for you. So always be in your natural tone and speak loudly. Maintain the fluency. Too speedy or too slow can create the problems as well. So keep in mind, as I have already told you, that interlocutor sitting in front of you is your patient and you are doctor. So he is your patient. Don't use medical jargons with the patient. Okay. And there is another important point is that you have to involve the interlocutor which is behaving as a patient. Patient involvement is also very necessary in OET speaking. Try to finish your card in 5 minutes. This is very important strategy for me. A lot of people would be there who will say that if you are not going to complete your card in 5 minutes, you can still pass the exam. Yes, you can pass, but there are a lot of students of mine who was not able to complete the task in 5 minutes, and they were not able to pass the exam. So if you are going to complete the card in 5 minutes, it will create a positive impact that you have done the card properly and you have completed the given task in 5 minutes. So always try to complete it in 5 minutes. But if you still have some time after the completion of card, then you can summarize the conversation. Okay. So be in natural tone, be loud, maintain the fluency, and try to complete in 5 minutes. These are the basic strategies for OET speaking. Now guys, I will tell you about the speaking template. I will tell you how you can introduce yourself, how you can get the history from patient, how you can examine the patient, how you can reassure, how you can sympathize the patient, and how you can end the conversation. So there is another important point, another important strategy as well. As you people know that we are medical doctors and we speak with our patient in medical terminologies. So for me, speaking subtest is easiest part of the OET exam. But if still you are weak in speaking of English, so I will suggest that you should learn by heart at least 2 template sentences for each. 2 sentences for introduction, 2 sentences for information gathering, 2 sentences for reassurance, 2 for sympathizing, and 2 for ending of the case. So I will now I will tell you one by one multiple sentences regarding introduction, history taking, examination, and every paragraph I will tell you multiple sentences. You can write it down on your notebook and you can learn 2 or 3 at least, so there should be no problem in the exam. Okay, and always try to speak with different sentence for introduction, different for examination, different for history taking, and different for sympathizing the patient in every role play card. Now I will start with the introduction. Okay guys, so guys, first of all, in the introduction there are 2 things. One thing is greeting and second one is ask about the presentation of patient, what brings the patient to you. So first of all, let me tell you one thing, that you can start the introduction in 2 ways. Once for the reading of the role play card, you will be given 3 minutes. You can ask the patient name in those 3 minutes, and if you haven't asked about the name of the patient, you can ask in the other 5 minutes as well. So 2 methods to start the conversation. If you have asked the name of the patient in 3 minutes, that's good. If you don't ask the name of the patient or interlocutor who is behaving as patient in 3 minutes, then you can perform as well. So first of all, I will tell you that how to introduce if you have not asked about the name of patient in 3 minutes. You can start like, hello, good morning, my name is Dr. Ahmad and I am one of the treating doctor, and I am one of the physician. I am your general practitioner here at this clinic, at this hospital, at this emergency department, or at this ICU department for today. Okay, so if you have not asked the patient name in 3 minutes, you can say, before we start the conversation, before we proceed further, can I ask your name? Can I check your name? Can I confirm your name? If you don't mind, you can process in this way. You can also ask in this way like, would you mind telling me your name? Okay, you can also say, may I have your name please? How may I address you? So guys, I have told you at least 6 to 7 ways how you can introduce yourself and how you can ask the patient name. So please note these ways, these methods on your notebook, and try to learn by heart at least 3 to 4, so there would be no trouble in your speaking exam. Okay, patient would say like, yes doctor, you can call me Mr. Harry. So then you will say, okay, thank you Mr. Harry for visiting me. Okay, thank you Mr. Harry for seeing me. Or you can also say that, okay, thank you Mr. Harry for coming here. Now please tell me, how can I help you? Okay, you can say in this way. Another way, let me tell you that, now please tell me what seems to be the problem. You can say as well, now please tell me what has brought you in to see me. Okay, there is another way. You can also say that, what brings you here today. So in this way, you can introduce yourself, you can greet with the patient, and you can ask why you are here to see me. So guys, if you have asked the name of the patient in the 3 minutes of reading of the role play card, then definitely you would write the name of the patient on the role play card, and you already know the name of patient. So you would start the conversation like, hi, good morning, it's Mr. Smith, right? Hi, good morning, it's Mr. Jerry, I'm right? So you will start in this way. Then patient will say, yes doctor, I am Mr. Smith, I am Mr. Jerry. So you will say, well, I am Dr. Ahmad, or you can also say, well, I am Ahmad, your general practitioner. I am Ahmad, your GP. I am Ahmad, your physician. So how can I help you? What brings you here today? What seems to be the problem? You can say anything which I have told you earlier. So here are the 2 methods for introduction which I have told you. So now I will like to discuss, if patient came for the follow-up visit, how you will introduce yourself. You can start in either way, like you can start good afternoon or good morning, nice to meet you again. Can I confirm your name if you don't mind? because you should basically you should know the name of the patient, but as patient came after 10 days, after 2 weeks, after a month, so you can forget it as well. So you will say like, good morning, nice to meet you again, can you confirm your name if you don't mind? But if you know the name of the patient, if you still remember, then you can say, hi, good morning, it's Mr. James, am I right? Patient would say, yes doctor, I am Mr. James. Then you can say, how are you so far? How can I help you today? So in this way you can conduct introductory session for follow-up visit of the patient. Now you have introduced yourself and you have asked about the problem of the patient. Now patient will definitely tell you about the problem. He can say that he has some abdominal pain, he has headache, he has cough, he has asthma, anything he can say. So after asking the problem of the patient and after listening the complaint of the patient, you will sympathize the patient. Like you can sympathize in many ways. I will tell you multiple sentences, you can write them down and you can learn by heart at least 2 sentences. Like you can say, oh, I'm really sorry to hear that, it's pity to hear about this. You can say, I'm really sorry to hear that, or you can also say that it's pity to hear about this. Now if patient is talking about pain, or patient is talking about some drowsiness, patient is talking about some depression, patient is talking about problem of someone else, like a problem of her son, her father or her mother, so then you will start according to the complaint of the patient. Like if patient has complained some pain, you can say, it must have been very painful for you, it must be very stressful for you. You can also say it must have been hard for you, it must have been difficult situation for you, it must has been tiring for you, it must have been frightening situation for you. Or if there is some emotional problem, there is some family problem, you can say, oh, I'm really sorry to hear about that, Mr. James, it must have been emotionally draining situation for you. So in this way I have told you multiple sentences, you can note them and you can use any of them in your speaking role play card. They will definitely help you. So guys, now you have sympathized the patient and now you will move for history taking and you can ask further question regarding the problem of the patient. So keep in mind that history and sympathy should go side by side. While you are taking the history, you should sympathize the patient as well at the time of history taking. Okay, so like you can start the history taking in this way, like, Mr. James, now I can ask you some questions regarding your condition, if you don't mind. You can ask other way, like, would you mind if I ask you some questions regarding your situation to get a better understanding of your condition? When a patient is giving history, you have to sympathize at the same time as well. Like patient came for abdominal pain and you have asked about the pain questions like duration of pain, severity of pain and the radiation of the pain. Patient has told you everything. Now you can say, I can appreciate how difficult it is for you to talk about this. You can say other way, like, I can understand your pain, I can understand that this must be a difficult situation for you. You can also say that your concerns are totally understandable to me. I know, Mr. James, how you feel, but let me assure you that you can also say, well, I can understand why you have this concern, please don't get worried, I am here to help you. You can also say, I can understand how difficult it is for you to talk about this. If I were you, I would have the same concerns, I would have the same difficulties like you. So guys, I have told you that history taking and sympathy would go side by side. Okay, so guys, now you have asked some questions, but you still have to ask some further questions, then you will take the patient consent as well. If you have to ask some further questions, then you can say like, would you mind if I ask you some more questions, some further question to get a better understanding of your condition? If there is some personal question, then you can ask in this way, I am afraid, Mr. James, I need to ask some further questions regarding your condition. Can I proceed please, if you don't mind? So you can ask in this way. And please keep in mind, always take history, always ask the question regarding the situation, regarding the presentation, regarding the disease which is given in your case note. Don't ask irrelevant question, always try to ask relevant question. So now you have done the questioning, you have done with the history, and now you have to examine the patient. Like some patient came with abdominal pain, you have to examine, you have to palpate the patient. And some patient came with throat problem, you have to examine the patient. Many of the students were asking me, sir, if I have to examine the patient, then I would examine the interlocutor in the examination. This is not a good question from the student side. Keep in mind that it is a recording, it is recording of your voice, not recording of your activities. You have to just ask the interlocutor for the examination. Don't try to examine the interlocutor. Like you can say for examination, thank you Mr. James, now I would like to see, now I would like to examine your throat, I would like to examine your abdomen, I would like to examine your knee. I can assure you that this examination would not cause you any harm or any pain. Okay, so in this way you can take the consent for the examination. Or you can say as well, like let me have a look at your knee, let me have a look at your throat, let me have a look at wound. I can assure you that this examination would not cause any harm or pain to you. So guys, at the end of the history and at the end of the examination, you can ask your patient like, have you tried anything for your problem? Have you tried any medication? Have you tried any remedy for your problem? Patient would say like, I have tried something, or I have not tried anything. Then you will say that, is there anything else that is bothering you? Is there any associated symptom with this problem? So here your history taking would be end. Okay, now you will move to the diagnosis on the basis of your history taking and examination. So guys, now you have taken the history and you have examined your patient, and now you will proceed to the diagnosis. So before explaining the diagnosis, you will say, thank you very much Mr. James for providing me all the relevant information. Thank you Mr. James for giving me all the information regarding your condition. So you should thank your patient. So then I will tell you how you can explain the diagnosis to the patient. You can start like, Mr. James, based on, or Mr. James, as per your history and after the examination, I believe that I can say that you have a condition. I can say that I believe that you are suffering from. You can also say, if you have examined the son of some patient, the father of some patient, you can also say that after the examination and after the history and based on the examination, your son, your father has a condition which we called as like asthma, diabetes mellitus, knee pain, gastroenteritis, this type of thing. Then you will ask about the knowledge of the patient. Does your patient knows about the problem? Let me tell you that how you can check the knowledge or understanding of the patient. You can say, have you ever heard about this condition before? Have you ever heard about this condition before? Do you know about this condition? So you can check the patient knowledge like this. So if patient don't know anything, so you will say, don't worry at all Mr. James, I will explain it for you. Well, don't worry, let me explain it for you. You can also say, well, don't worry Mr. James at all, I am here to help you, I will clear everything for you. So guys, in this way you can discuss the diagnosis to the patient, and you can also check the patient understanding. So if there is some problem with gastroenteritis, then you can say, well Mr. James, based on the examination, based on the history and after the examination, I can believe that your son have a condition which we call as gastroenteritis. Have you ever heard about this condition before? Patient will say that, no, I don't know about this condition. So you will say, don't worry Mr. James, let me explain it for you. This is basically a condition which is caused by dash 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 dash, and its clinical features, its signs or symptoms are dash 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 dash, and there are effective treatment options are available. Then you will describe the treatment options according to the case note. you have to describe the treatment option from the role play card, from your case note. Don't tell treatment option out of the role play card. You have to speak from the role play card. Okay, so guys, up till now I have tell you that how you will discuss the diagnosis on the basis of history and examination. So if patient came to you to get the some test results, some laboratory test results, some MRI reports, some CT scan reports, ultrasound report, then now I will tell you that how you will discuss the diagnosis on the basis of test results. Like you can say, Mr. James, your test results are back and which are consistent with a condition which we called as. You can also say, well, Mr. James, your x-ray report is here and I am really sorry to tell you that on the basis of your x-ray report I can say that you have a problem in your lungs which we called as TB. Okay, if patient is here to get CT scan or MRI report or ultrasound report, you can say, oh well, Mr. Jones, so I have your ultrasound, I have your MRI, I have your CT scan report with me, and based on this ultrasound report, CT report, MRI report, I am sorry to tell you that you have a condition which we called as hemorrhagic stroke, or you can say anything else which is given in the report. So in this way you can discuss the diagnosis based on the laboratory test. So now you have disclosed the diagnosis to the patient, and at the end of this you will check the understanding of the patient. So you have tell your patient that you are suffering from a condition which we call asthma, TB, diabetes mellitus, like this or anything else. So now you have tell everything to your patient, and now you will take the understanding of patient. You can say that, am I clear to you, Mr. James, so far? Are you getting me, Mr. James? Are you following me, Mr. James? Are you on the same page, Mr. James? Are you understanding me? So you can check the patient understanding in this way. So guys, always try to memorize at least 2 or 3 sentences. Like I am telling you multiple sentences. At least you should cram 2 sentences so that you can use in your 2 role play cards. They will definitely help you. So guys, now we have disclosed the diagnosis to the patient, and definitely after listening to the some disease name, the patient will get alarmed. You have to reassure the patient. This is very important point. I have written here that reassure the patient along with the diagnosis and treatment plan. After discussing the diagnosis, you have to reassure the patient, and during the discussion of the treatment option you have to reassure the patient as well. You can reassure like, please be assured, Mr. James, please be assured that this is quite common condition. You can also say that rest assured that this is a self-limiting condition. If you can follow my advice, this will go away by its own. You can also say, let me assure you that asthma is a quite treatable condition. If you follow my advice and if you will take the medicine properly, it will be treated in few days. So let me tell you further about that, how you can reassure your patient. You can say like that, rest assured, asthma is a quite common condition and you have there is no need to worry about that. Secondly, you can say that please be assured it is a self-limiting condition. If there is some self-limiting condition in the role play card, then you can say that please be assured it is a self-limiting condition. It will go away by its own in few days after completion of the course. So in this way you can reassure the patient after the diagnosis. So guys, after the reassurance, then we will move toward the treatment or management options. So I have again written here that reassurance is really a necessary part of treatment option. Reassurance is also a necessary part of diagnosis. So first of all, you have to reassure, then you have to explain the treatment options according to the card, according to your role play card. You have to discuss only the treatment options which are given in your role play card. Okay, then at the end, you will check if the patient will be able to act upon the plan, upon the treatment option which you have discussed. So let me tell you some sentences how you can tell about the treatment option to your patient. First of all, you have to reassure again in the treatment option, like you can say, well, Mr. James, first of all, I would like to assure you that please don't worry, I am here to help you. You can reassure in this way, or you can reassure in other way as well, like let me assure you that Mr. James, you are in good hands. Let me assure you that we have really experienced staff, or we have really experienced team here, and they will take good care of you, and in few days you will be out of danger. Okay, then you will discuss about the treatment option which would be given in case note, like you can say, first of all, we will start some IV antibiotics. After few days you will be shifted on oral antibiotics, and then we will start some physiotherapy exercises as well. So you will discuss all the treatment options which are given in your role play card. Okay, so guys, at the end then you will again check that if patient will be able to act on the advices on the treatment plan you have given. You can check like, do you think you can do that, Mr. James? Like, do you think you can do that, Mr. James? Do you feel comfortable about my advice, Mr. James? Do you feel comfortable about my advice? Well, Mr. James, how does that sound? As I have told you a lot of treatment options, how does that sound, Mr. James? Then patient will definitely say, yes doctor, I can do with your help. Yes, I will be able to act upon your recommendations. If patient if the recommendations are difficult, then patient will definitely tell you that it's really difficult for me to act upon your plan. So then you will have to reassure as well. So guys, if patient is reluctant upon your recommendations, upon your treatment options, then you can say like, oh, Mr. James, your health is our main priority, and we are focusing mainly to relieve your suffering, to relieve your pain, to relieve your problem. So for your better health, please try to be ensured that you will be able to act upon our advices or our treatment plans. So after discussing the treatment and management plan, then definitely we will move toward the ending of the role play card. Definitely we will ask the patient if there is any other question you want to ask. Like we can ask, is there anything else you want to ask me? Is there anything is there any question that is bothering you? Like this type of question you can definitely ask at the end of your card. Okay, now definitely patient will say, no doctor, thank you very much, you have addressed my concern properly. Then you will say, well, Mr. James, I am pleased to hear that I have addressed your concern properly. You can also say, well, Mr. James, I hope that I have addressed your concerns in a proper way. Okay, so patient will say, yes doctor, you have addressed my concern properly. So if you have to call your patient on a follow-up visit, then you will say, well, Mr. James, I would like to see you in a week. I would like to see you in a better condition after a week. Please do not hesitate to contact me if there is any issue. Okay. And if there is no need of any follow-up visit, then you can say, I wish a speedy recovery for you, Mr. James. Please do not hesitate to contact me if there is any other issue. Then you can say, thank you very much for visiting me. Take care. Okay. So guys, if you have done everything, you have done the introduction properly, you have get the history, you have done the examination, and you have explained the diagnosis, you have explained the management plan. But if you still have some time, like 40 seconds, 30 seconds, then you have to summarize the whole case. Like you can summarize the whole case in 3 or 4 lines. Yeah, like you can say, so Mr. James, let me summarize the whole conversation for you. Today, unfortunately, diabetes, asthma or some other disease was diagnosed. We have discussed its causes, treatment plans and complication and lifestyle changes as well. I wish that this session would really help you in managing your condition. Thank you for visiting me. Take care. So guys, in this way you can summarize your conversation from the whole of the role play card. So guys, you have to done everything in 5 minutes. So guys, in the 5 minutes you have to done your case notes like this, and you have to complete the case note in 5 minutes as well. At the end, I would like to say again that please try to write these sentences which I have told you on your notebook, and try to memorize by your heart, try to learn by your heart, as there is no problem in learning by heart, as we are learning by heart many things from our graduation, from our intermediate period. So we can also memorize by heart, we can also learn by heart 2 or 3 sentences as well for our speaking purposes. So I will make a separate video on reluctant patient, on breaking bad news as well. So please remember me in your prayers. Thank you very much. Allah Hafiz.